Welcome to Orthodontic Smiles, the podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontics Society. Today on Orthodontic Smiles, we have Dr. Elsa Echeverri, a very, very prominent person within the American Orthodontics Society. She's a pediatric dentist and is actually going to be one of the premier speakers at the American Academy of Pediatric Dentistry joint meeting with the American Orthodontics Society in Kauai after the AAPD meeting. There'll be 4 of us speaking at the AAPD meeting. That will be myself, Elsa, Chris Baker, and Lenny Carapeza. We are all pediatric dentists. We all practice orthodontics in our practice. And so I thought it would be a great idea to have Elsa talk to us a little bit about her background and how she got started in dentistry and how she got started in orthodontics and as a pediatric dentist. So Elsa, welcome to Orthodontic Smiles. And how did you get started in dentistry?
First of all, Ed, thank you for the invitation. This is an honor to be sharing this time with you. To answer your question, I started in dentistry. It's a family tradition, I guess. My dad was a dentist. My older brother was a dentist. One of my uncles was a dentist. And they all were faculty members at the university in Venezuela, Central University in Venezuela. So I practiced as a general dentist for 4 years until I decided I needed more training. And that's when I applied. I was living in Venezuela then, and I applied to different programs here in the States.
Well, how many years do you go to school? It's a different educational process in Venezuela. How many years did you go to dental school? And did you go directly from your high school into, from your college into dental school? How does that work there?
It works there for all of us. We have 1 more year of high school than here. It's like probably 13 years instead of 12. And then we go straight from our high school to the university. We do 5 years of dental school, and then 1 more year, it's mandatory, in the rural areas, serving the communities that are lack of those services. That's 1 more year. So it's a total of 6 years.
And so you're
you're
practicing dentistry even in the rural areas.
Correct. For a year right after you graduate from dental school, it's mandatory for everybody to serve 1 year in a rural area.
So after you got your dental degree in Venezuela, you practiced for how many years?
For 4 years.
4 years.
I practiced.
Was it in a rural area, or was it in a suburban area? What kind of practice was it in?
I opened my private practice. I was living in that moment in Maracaibo, that is another big city in Venezuela, the second most important city in Venezuela. And I opened my practice there, and I practiced there for a couple of years until I moved to the capital city, to Caracas again. And I practiced there with my dad. My dad had his private practice there for a couple of more years until I decided, no, it's time to specialize. It's time to decide what I want to do. And I had the inclination. I thought I was going to be an endodontist, and I did a lot of continuing education in endo. But then I decided, no. I like what I do in pedo, and I'm very passionate of what I do. I think pediatric dentistry gives us the opportunity to practice dentistry completely. We do surgeries, we do a little bit of prosthetics, we do endos, we do restorative, we see special need kids, and we do ortho. We can change, there's a lot of patients, pediatric patients, that can benefit by our expertise in ortho. So that was one of and I received ortho training during my residency at LSU. LSU has a great specialty program. In those days, Dr. Jim Chata, that was the chair of the Department of Orthodontics, and Dr. Jack Sheridan were our faculty members, were our ortho instructors. So we as pediatric dentistry residents received our phase 1 training from two very well-known orthodontists.
Absolutely. Jack Sheridan was a hallmark of orthodontics at LSU and a very famous orthodontist. So you're very lucky to have had that kind of training from him.
Yeah,
but,
unfortunately.
But let me back you up just a little bit. So after 4 years of your training, not 4 years, after practicing general dentistry in Venezuela for 4 years, you made the decision to go into pediatric dentistry. Why pediatric dentistry? Why didn't you go in? You said you wanted to go into endo, but what changed your mind to go into pediatric?
Just the fact that in endo, I said, wow, I'm going to be and now with the new technology, that concept that I have of endo have changed, because I just said in the past, we just imagine what we were doing in endo. We filed and we were just imagining, but now with the new technology, they can see everything on the screen. But no, I decided pediatric dentistry because I could take care of the children since they were infants, since they were babies, until adults. And I could keep practicing general dentistry. I could keep practicing all the specialties.
Well, that's exactly, Elsa, don't feel bad about that, because that's exactly the reason why I chose pediatric dentistry as my specialty, because I had the opportunity to do everything. I didn't.
Correct.
I was actually feeling the exact same way you did in junior year of dental school. I was thinking endo. I thought that was the up-and-coming profession, and I thought that would be great. I would enjoy doing that, and then I am so glad I didn't do that. Can you imagine all day long sitting there with files and reamers doing the exact same thing? We are so lucky to be pediatric dentists because we get a chance to do everything, and have something different coming in the door every moment of the day. So that is just our paths have crossed, and I understand why you went into pediatric dentistry. And you had some good training in ortho even back then. I did as well. I was in a program at University of Pennsylvania's Children's Hospital of Philadelphia. And at that point, they actually had a program to fund the dental clinic doing orthodontics. So part of the residency program was to actually work with the orthodontists who were doing orthodontics in the pedo clinic. And so we got a chance to do a tremendous amount of full comprehensive orthodontic training on indigent patients. And it was fun. I learned an awful lot. And it really kind of sparked my attitude about doing early treatment orthodontics on kids. Back then, there was no such thing as early treatment orthodontics. Now there is, obviously, and that's what we want to get into talking about. So, but after you became a pediatric dentist, what happened to you then? Did you go into private practice?
I went in. I practiced right after I finished my program. The LSU postgraduate program, the LSU program hired me. So I taught for 1 year full-time at LSU. And then we moved to Texas. And then I was hired by University of Texas Dental School, dental branch in those days. Now they changed the name. Now it's University of Texas Houston School of Dentistry. I was hired there as a full-time faculty member. So I taught for 7 years as a full-time.
By that time, you were married to my good friend Juan Echeverri, who is one of the associate instructors of the American Orthodontics Society. I'm telling you, when you go to one of his courses, you learn so much. So I'm so pleased that I get a chance to interview you, and I know he's on my schedule to be interviewed in the future. So tell him I'll be giving him a call any day now. So now, when you moved to Houston with Juan and raised a family, you started teaching at University of Texas.
Correct. I've been teaching in the university since 1989.
Wow.
I went part-time, 50%, and then I am twice a month there now for a full day with the residents. So, and that going back to education, that's what I tell the residents, that I learn from them, and I love to teach, and I encourage them, each one of them, to become faculty members of some time, maybe 1 day a week, 1 day a month, because there's every day a learning experience in the graduate program. Well, and in our offices, every single day we learn something different.
Well, Elsa, that's why they call it practice, because every day we practice to get better, and that's important to any resident that's coming out. You're not going to learn everything the first day you get out of your training. It comes with years and years and years of trial and error, and the best that they can get out of their practice is having someone like you helping them know what the failures were. I always say a mentor is somebody who's made all the mistakes and conveys that information to the student. And I've had some great mentors, and you're acting as a mentor to them as students. That's important.
Yeah. And something else very gratifying about teaching is that you giving back. Somebody, in some time in the past, they taught you something. And if you're able to pass down that knowledge, you're giving back. You're giving back to the world, to the society. And I encourage them to give back,
I tried to reach you on Monday and on the phone, and was unsuccessful because you spent the entire day in the operating room with your students doing OR cases. I remember those days emphatically, and I don't know whether or not they were great or good, but I remember doing many, many, many OR cases, and I always looked at the attending in the operating room, sitting there reading a newspaper while I was doing all the work, and I just kind of, I'm sure you were doing the same thing.
I stand right behind them, watching every single move, and I tell them, no, do this. This will save you time. Turn that around. Cut with this burr. Do this, do that. The whole
great.
time
that's
right behind them.
That's a great way to do it. I remember going. I was an associate professor at the University of Florida, and I remember going into the clinic and I asked the student, how long does it take him to put on a stainless steel crown, and he said about 20 minutes. I said, okay, I am going to help you, and you're going to put that crown on in 7 minutes. From this moment, you're going to have the crown seated, cemented, and cleaned in 7 minutes. Just listen to everything I tell you to do. And so I guided him through the whole process, and he was done in 8 minutes, but it surprised him that he could do that. So having a mentor standing behind you, telling you what to do and how fast to do it is a really great way to learn pediatric dentistry. But you're just not teaching restorative dentistry. You're out there educating these students, these young pediatric dentists, about orthodontics. So tell me about that.
Yes, part of what I teach him how to do surgery, and I teach him how to do orthodontist. I show him my cases. Every other Monday, we sit down on seminars, and I show them my cases. There is right now an orthodontist in the clinic that teaches them ortho also, but I want him to see my perspective as a pediatric dentist, what type of orthodontist I do, and how do I do frenectomies, when do I do frenectomies, when do I expand, when do I use an RPE, and when do I use the MPE, the Nitanium Palatal Expander. And I mentioned to them that in 2 years, 3 years of graduate training, you cannot learn it all. You learn, like you said, in practice, when you're in practice. So the more they're exposed, the more they see, the more they be able to do when they're out there on their own. And having an associate, like I learned a lot from American Orthodontics Society. I was very, very impressed when I joined that society because they had pedo cases. I remember in that display that Dr. Garrity had in the courses, he had pedo models, and that was so gratifying. Then I heard Chris Baker. I took her courses, and she's a pediatric dentist. She taught a lot about airway. So I sat in your courses too, and I learned a lot of things from you. So to me, it has been a compliment to my practice. I incorporated the Nitanium Palatal Expander that now I enjoy and use a lot because what I got from the AOS lectures. And I show him and I teach him that to my residents.
That's wonderful. That's the kind of thing. They need to leave their residency training understanding that there is some orthodontics that they can do, and if they practice that in their offices, they're providing a tremendous service to the children. It's something that, in my experience, that if a pediatric dentist does not provide orthodontic training or some orthodontics for their patients, that they're basically not providing a full service. They are the experts in growth and development. They learn more growth and development than even the orthodontist does in their training. And so they're very well equipped from the very start to learn early treatment orthodontics. If they don't want to do any more than just early treatment orthodontics, that's great. That's up to them to make that decision. But they need to be able to provide that service because we're seeing those children between 3 and 7 years old that desperately need some kind of early treatment intervention.
Definitely.
Right.
Not all that children's needed, but the ones that needed, they needed badly. And it's our responsibility, really, it's our responsibility as pediatric dentists to be able to provide that. Now that you were mentioning that, I remember when I was in dental school, I felt the ortho department was not teaching me enough. I didn't understand. They were giving us very superficial knowledge. And I went to the orthodontist faculty member and I mentioned to her, I said, you know what? I'm not going to be an orthodontist, but at least I want to know why am I referring you my patients? So yeah, she looked at me like, and I have my residents understand why are they doing what they're doing. I remember when I was in residency, Dr. Chara mentioned once, when do you correct a crossbite? When you see it, he answered. When you see it. The only thing we need to take into consideration is patient cooperation, and of course, the parents' approval. But anterior crossbites, posterior crossbites, we have the tools to correct those if we have the cooperation of the child.
Yeah, exactly. And there are ways to get that cooperation even as early as 3 years old. Why wait until you're 12, 13, 14, 15 years old to correct a posterior crossbite when you can correct this and fundamentally correct it for the rest of their lives at age 3? And then from that point on, development occurs normally. So we're in a position as pediatric dentists to provide a service that is very easily learned because of their abilities in growth and development. And I would encourage every pediatric dentist, and I know you feel the same way, that they should get out there and learn this. This is something that's easy to learn and available to learn through the American Orthodontics Society. But that's correct. What other kinds of orthodontics do you do in your practice, Elsa?
Well, I'm presenting this year in the Academy meeting in a string of pearls, the use of the Titanium palatal expander. I was trained at LSU to use the W arch that I don't use anymore, the quad helix, that is a very, very good appliance and it has many uses. But I have found that I can do everything I used to do with a quad helix with a Titanium palatal expander and more. I do lots of things with the Titanium palatal expander. Of course, I use the RPE. There's some indications for patients where that is the appliance of choice. I use a 2x6. That means 2 bands and 4 to 6 brackets, a 2x4 or 2x6. I use lip bumpers.
And that's putting a bracket on the primary canines.
Well, on the primary canines, correct. I even corrected a case where I placed, and I published that in the AOS journal, and I placed brackets on the lower arch because the extra space, the child was in crossbite. It's a very rare circumstance. The lower arch was the one that had spaces everywhere. And so I placed the brackets on the lower arch and I corrected the crossbite that way. I never touched the upper arch.
Yeah, you consolidated the lower and that
correct
that
the lower
the
and
crossbite.
Correct. I also use face mask. I use in class 3, skeletal class 3s. I use the RPE in conjunction with the face mask. And if that's the appliance of choice, and you need the compliance of the patient and the parents.
Well, you probably heard Orthodontic Smiles when I talked to Luis Carrier. What he is doing right now is using the Motion 3 appliance on primary dentition, where he is putting an RPE on the upper and running and the Motion 3 appliance on the lower in the primary dentition. He's expanding the upper with the RPE and then running class 3 elastics to the Motion appliance and correcting these young children at 4 and 5 years old with their class 3 compromised dentition.
Yes.
Yeah, it's just amazing what he has accomplished with such a simple appliance. So I'm thinking that the days of the appliances that were so difficult for us to master, the quad helixes, the RPEs that are so bulky. I think those appliances are slowly going away with the innovations that we're seeing in orthodontics. I mean, I've been in practice for many, many years, and all the changes that have gone on in the years that I have been in practice are immense. So I can't imagine. It's like the cell phone. You know,
correct.
10, 15 years ago, we didn't even know what a cell phone was, and or at least a smartphone. And nowadays,
we cannot live without.
We can't live without it. You know, so it's what's happening. You know,
Correct, correct.
I think our future and these residents have such a future in orthodontics. They just need to get started with it, and I'm so passionate about that. You hear me talk about it all the time on Orthodontic Smiles, that pediatric
Correct.
dentists need to get involved in at least doing early treatment orthodontics because the patients need it so badly. But you have just not been doing orthodontics in this country. You have this unbelievable passion for doing dentistry in other countries that need your services. So tell me about that.
I go to Guatemala for a mission trip. It's a medical dental mission trip with Faith in Practice, that is a non-profit organization, to provide service for special needs patients in Guatemala. It's a beautiful mission. This is a place that is a hospital, a hospice, and an orphanage that houses like 350 special needs patients from birth to adulthood, because it's a hospice, it's until they die. And in the past, there was nobody to take care of them. So this organization, that it was funded by the Wyatts here in Houston, a beautiful couple that funded this organization, they remodeled this hospital ORs. And Texas Children's has been, in the past was only Texas Children's. Now there's volunteers from all over the world that go in a week period to provide service there. So in the past, I've done 11 trips so far, and I've been able to restore full mouth restorations on more than 100 children. So I am passionate about it. And I see special needs in my practice here too.
Do you take the students with you?
Sometimes, and I've taken my colleagues. I have taken all my 3 girls with me.
Oh, absolutely.
And that has been a life-changing experience for them.
Absolutely.
Because it's beautiful what they see there and how grateful the Guatemalan people are, and the incredible dedication of the physicians. I go with a surgical team, and the surgeries that they do and what the services that are provided through that week of a mission, that you see the hands of God everywhere because of the miracles that happen every single day.
Oh, absolutely. Yes. I was involved in a mission trip to the Dominican Republic for 17 years. I did exactly what you did. And there's a couple of things that I think are absolutely important. Number one, you need to take your kids to see how lucky they are, number one. Mm-hmm. And number two, one of the things that I've heard people say is that there's an old saying that is out there. I wonder what the poor people are doing. As you're sitting in your beautiful home in your back in your pool deck, people will say, "I wonder what the poor people are doing." And let me tell you, I know what the poor people are doing.
Mm-hmm. Yes. Yeah, and when I watch people from the car that, you're looking outside, you say, I could have been any of those walking,
exactly.
Without shoes.
For the grace of God.
With groceries. Correct. I could be one of those. I could have been one of those. Mm-hmm.
Exactly. So I never say those things anymore. I never would even, and anybody that says them to me, I let them know what the poor people are doing and how grateful I am to be able to provide a service for the grace of God that not too many other people can do. So
correct.
We're very lucky, also you and I, to be able to provide those services to people that need us. And even here in the United States for special needs, I do orthodontics on special needs patients because no orthodontist is going to do it.
I do too. I do too. And it's amazing how because we autistic kids, Down syndrome kids, how they behave, how well they behave when they realize, when they look at themselves in the mirror and they look at the old pictures, they are incredibly grateful and behave even better when they see the changes as we take pictures of their faces in their mouth and the way they bite, the way they smile. So it's incredible. It's amazing.
Well, it's you know, God has given us a gift, and so we're going to keep using it. People ask me when I'm going to retire, and I said, you know, I think I still got a little bit to do on this work. So I don't think I'm going to retire anytime soon. I'm just going to keep doing what I'm doing until somebody taps me on the shoulder and says, Ed, maybe you shouldn't do this anymore. So I'm going to keep doing it. So anyway, Elsa, tell me about your connection with the AOS. I mean, how has this caused you to, or let me say, enlighten you to the needs of your patients and how much education the American Orthodontics Society has provided?
I love the organization because, number one, it's a wonderful group of people. We have wonderful friends there. It's a very friendly environment. Small groups, you learn a lot, and you see how rich in knowledge all the instructors are, and they're all different. As I said, I learned to use different appliances that I was not used to, how serious they take the education, how the diagnosis is so important, how you have to see each patient individually, analyze it really well with all the knowledge provided, and all the records have wonderful records. I love the way the AOS does the examinations, especially the board examination, that you have to be super, super detailed and perfectionist in your models, in your cases, in the selection of your cases, your diagnosis, your treatment plans. So it's a very well formal and concrete knowledge what I have gotten from the AOS. I am very pleased.
I mean, it's all something you can learn. I mean, we don't expect
correct.
We don't expect students to come in there and know anything. We take them from knowing nothing to being able to be diplomates of the American Orthodontics Society, and
correct.
and be able to provide the services at the very highest level. So I look forward to, I know your husband is just awesome in the kind of orthodontics that he does, and he's such a great teacher as well. And I am looking forward so much to hearing you in Kauai, Hawaii, after the AAPD meeting. We will be there for a great seminar put on by the American Orthodontics Society and the AAPD. So I will encourage every pediatric dentist that goes to Hawaii, why not go over and see another island, the beautiful island of Kauai, and hear another great seminar going on in right after the American Academy of Pediatric Dentistry's meeting. So you're on the dais, and I can't wait to hear what you've got to say. So it'll be fun. Elsa, I can't thank you enough for being on Orthodontic Smiles. This has been an enlightenment. I like listening to your history. I know you and Juan very well, but I think other people need to know you as well as I do. You're a special individual who practices pediatric dentistry, who does orthodontics, and is trying to share that knowledge. So I want to thank you for being Orthodontic Smiles today.
Thank you for having me here. Thank you. I enjoyed it.
This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.